All right, let me get this. Hello, everyone. Uh, Thank you all so much for joining. This is a professionally integrated webinar on a research article that we just published. This will obviously be up for everyone that's on here, and I hope you stick for the whole thing. So what I'm going to do is I made a PowerPoint presentation about the article that we did, why we did it, what it shows, and how to use this in your practice, how to use the research that we did here, the research that is on this site to educate your patients, to inform them of the importance of what it is that is wrong with them and how you can help. So let's just get right into it. I don't want to take up all your whole night, but certainly feel free to ask questions. So we're gonna get right on to this and get started. Let's see here. All right. So welcome. I'm going to keep popping in and out just to make sure that no one has any questions or anything like that. And I'll try to answer all of them at the end. So a little history of this article that me and these other amazing authors were able to put together. I actually started this in 2006. My wife and I practiced, and we started getting patients that were involved in a crash. They had bad necks. And then very shortly after, they ended up getting in another car crash. And we're like, wow, we now have real evidence of, does their neck change? And we started to put it all together. So we wanted to know, similar to how motor vehicle crash companies always ask, how do you know the crash caused the kyphosis? So we wanted to look at that, and there's a lot of biomechanical papers, some of them we're going to go through tonight, that discuss that, but no IRB, which is an institutional review board, would say, and this is very important, I want you all to understand. So if you're educating a patient or some insurance company or attorney is questioning you about this, this isn't really important. The reason that this has never been done before on live volunteers is you could not get an IRB approval, meaning an IRB or an institutional review board is like, hey, we're going to do this to the public. The IRB looks to see if it's safe. There is no evidence that a car crash, regardless of the speed, is safe for the public. Right. And that's important if you start to get picked on by some insurance company. Oh, well, the reason that you can't just do this is every study that's ever been done on car crashes explains and shows that no matter the speed, people get hurt, so it won't be allowed. So we couldn't take patients to say, hey, we're going to put you in a crash and look at your neck and study it because it wouldn't be approved. So we had to do this because we couldn't study it. So what we did is we had to find out what really happens. And that's why this took so long. So this is super important if you get picked on to explain to these insurance companies. So how did we do this? Well, this was really hard to do because think about this. We got patients that were involved in a car crash that came to our office, just like if they came to yours. And within 24 hours, and up to a max of 6 weeks they got involved in another crash. Now, these patients couldn't get surgeries. They couldn't really get a lot of treatment. They certainly couldn't go through with a corrective care because we had patients that were under care, were getting treatment, were probably close to getting maybe another x-ray if you do corrective care, restoring the curve, and then they got in a crash, but we don't know how much their neck changed. So we had to exclude them, right? Does that make sense? So maybe they were 8 weeks into care, getting ready for another image, and they get hit again. We assume, based on our clinical experience, that their necks have changed. So we didn't think that the x-ray that we had would be a full, true representation. So we took patients and we found people that we x-rayed them, and then some were within 24 hours up to 6 weeks with no significant findings. Or no significant types of treatment. I just want to make sure that no one has questions and you could all see the screen. Okay, let's get right back to this. So what did we find, right? So Oops, let's see. So we found that kyphosis occurred. And again, you have to remember when educating your patients that these patients already had bad necks, right? They were already coming in due to a crash. They already coming in with pain. We found that their necks buckled more, right? So they had a bad crash, they had a bad curve, and then a crash happened and it got buckled again. We also saw that in the neutral position, a certain percentage of patients ended up getting anterolisthesis, right? So we didn't look at the instability aspect. We'll talk about that a little bit later. So right from the get-go, for us to understand and to educate our patients and how you should use this information and all the info that's on Professionally Integrated is, hey, you were in a crash. There's strong evidence, not just from biomechanical studies of cadavers and biorid dummies, but here's one that was published in the Journal of Diagnostics that says car crashes causes buckling. So there always used to be, how do you know, right? And I've been asked that so many times on the stand. How do you know the crash caused this? Buckling, because you didn't have an x-ray right before. And there's a lot of different ways that you would have to put that into play. I have webinars on the site about this, tons of biomechanical papers where you can look. But what you had to do was like, hey, here is the biomechanical studies to show this is what happens. But they weren't on live specimens. So we had to look at their history or lack of history. We had to look at cadaver papers, biorid dummy papers, right? Those are the things because it's never been studied before until now. So as you can see on the site, as you're all, hopefully a lot of you are members, just under the diagnosis, you can go to loss of curve. And you can see under each diagnosis, there's a checkbox of causation, chronic, joint. I clicked on causation, and here's a bunch of papers that come up that talk about how car crashes cause a buckling of the neck based on biomechanical studies. So that's one way, obviously, to continue to use like, hey, here's other studies, plus here's now this one. So let's take a look at the paper, right? So again, this was just published in the Journal of Diagnostics. It is PubMed. Abnormal static sagittal cervical curvatures following motor vehicle collisions, a retrospective case series of 41 patients before and after a crash exposure. So these are some things that these amazing authors that we were able to get in the paper. And I'm going to break this down very similar to how I break down the other hundreds of articles and videos on here, ways for you to know, to understand, but ways for you to show your patient, quickly document, and put in your notes. And these are some things that I just want to show you from the paper, and I can send you all the paper, the full paper for you to read. But I broke down some really important aspects as it relates to our care and our treatment and our understanding of car crashes. So this is in the paper that you should, on the site, you'll be able to copy, paste, put in your notes, show your patients, and talk to them about it. Conditions such as headache, neck pain, and myelopathy, with and without neuropathic radiculopathies resulting from motor vehicle crashes, frequently become chronic and debilitating, right? So when insurance companies say most people get better, here's another paper that actually discusses that that's, again, not true, right? There's no study to suggest that. And there's obviously tons on the site that you all know about. So we also put this in here. In patients with injuries resulting from a motor vehicle crash, a correlation between an S-shape, a kyphotic, a hypolordotic curve configurations, and cervicogenic pain, right? Not just neck pain. Pain from the neck, cervicogenic pain, radiculopathies, and increased rates in degenerative disc disease have been reported, right? There's tons of evidence to suggest that a loss of the cervical curve leads to worse outcomes, pain, disc problems, and other types of issues. These abnormal structural configurations are associated with multiple symptoms and worsening of prognosis. Doctor, why are you treating this patient more than 6 visits? Well, you diagnosed they had a loss of curve. And here's one more paper that shows like, hey, Mary, you have this loss of curve. This has actually been associated with poor outcomes. And that's why we're recommending you come to our office so we can improve your curve. This was published. So we also found what's called snap-through buckling, right? So snap-through buckling is characterized by a visible and rapid transition from one equilibrium configuration to another. Biomechanical investigations confirm that sagittal cervical spine exhibits snap-through type and dynamic buckling behavior in responses to impact loads, where complexity is related to curve configuration, the posture at impact, and rate and magnitude of loads. Now, we know things that you all need to be asking, and I've done tons of webinars on this, and there's tons of papers for all you members. What was the position and impact? Was there head turn? Head turn does what? Increase the likelihood of facet irritation, facet damage, facet instability, upper cervical instability, all those types of things. We need to know that. You need to know what their head configuration is. And look what we found in or what we wrote in motor vehicle crashes, acceleration, deceleration event. And we, again, describe what happens to the cervical spine. There's tons of biomechanical papers to show that the neck takes this S-shaped curve. We put this into the paper. You could easily just put in your notes, show, hey, this is what has been shown to occur in biomechanical studies. And again, as a member of Professionally Integrated, go up to the search bar and you can just type in S-shape and you can see tons of papers and information comes up as it relates to car crashes, head restraints, everything that has to do with an S-shaped curvature. So you can add more to your notes, add more to your education, and of course, document more. So what did we find about these patients? Well, in addition to just looking at their neck x-rays, we examined all these patients, obviously, right? They came in for a crash, we had examinations. And then we looked at their numeric pain rating score, the NPRS, where we did 0 to 10. 10 obviously being severe, so on and so forth. Of all 82 sets, right? So again, we looked at 82 images and we have 32 combined points on each one. So 32 times 82 is a lot of data that we were able to collect. So we looked at the lateral cervical spine, right? We used digitization. So it's another paper that validates the use of digitization. We used the posterior hard palate, making sure that their head position was correct. We used the posterior portion of the foramen magnum, the anterior and posterior tubercle of the atlas, and all the four vertebral bodies from C2 to C7. And then we digitized it, right? So this is, in a sense, what we did and how we digitized to get the ARA, the absolute rotational angle from C2 to C7. And then we looked at the RRA, the relative rotational angles of each individual vertebra, and then the angles from one another. And then compared it to what it was before and where they are now. And then we also looked at translation, which is, translation of the z-axis of C2 to C7, or what's considered anterior head translation, or CSVA, the cervical sagittal vertebral axis line, which is also correlated to poor outcomes. And there's tons of articles on this site as well that discuss that. So here's table 1 in our paper where we looked at their height, their weight, their sex, 15 males, 26 females, and we had an age from 8 to 65 years old. We looked at their pre-NDI scores, and then we looked at their NRS scores, the p-values and all that stuff. That's all the good research to show how accurate it is. But as you can see, 30 of them were rear-ended. That's primarily the type of crashes that we see in our practice. We had 2 that were in the front, 7 side and oblique. So what we found is another paper that regardless of the configuration, we're seeing a significant change and injury of the cervical spine. And here's what we found with their initial lateral cervical radiographs. We were able to show where they were, what their maximum value was, their minimum values, what it was after the first crash, and what it was after the second crash, and if it changed. Here's a couple of pictures. 2A is obviously after the first crash. Again, we started with bad necks. There's only so much worse these necks can get, right? We started with bad, and then we saw they got badder. We didn't start with these great asymptomatic lordotic curvatures. So what we found was, as you could see, a buckling with increased anterior head translation, and then 2C, not much anterior head translation, but more of a buckling in the mid-cervical spine. This is a graph we did early on, and blue is the established ideal normal of the cervical spine. Green was before the second accident. So these were bad necks. Remember, these patients came in after a car crash. Their necks were not great. Again, we couldn't study, hey, you're an asymptomatic individual. We're going to x-ray you, and then we're going to subject you to a crash. That's almost impossible to do or unethical. So we started with necks that weren't great. And curiously, what I found is a lot of times when these patients have really good necks and then they buckle almost to some degrees, you can get more of a change, right? But we still found the significant change. And then red is the third crash. And as you can see, the mid-cervical spine, where it should be more anterior, is now more posterior. And the upper cervical spine is now increased anterior head translation. So we found a higher increased anterior head translation with more of a buckling or kyphosis in the mid-cervical spine. All of these things are correlated to biomechanical studies, but they're also correlated to poorer outcomes. There's studies that show that they become More chronic. There's studies on the site to show that it can decrease blood flow, that it increases disc herniations, that it leads to more degeneration. All the things that you should be educating your patients about. Hey, this is what you have. This is what can happen to your neck. So on the lateral, we looked at difference in comparisons of the initial pre-motor vehicle crash of lateral translation radiograph, and the magnitude of these segmental translations approached the limits of allowable maximum joint movements at 3.5 millimeters before instability occurred, and represents abnormal alignment suggestive of ligamentous injury. But note that this threshold does not exceed the limit of true translational instability, and thus is consistent with subcatastrophic damage to connective tissues. Now, what's interesting is some of these patients reached almost the upper guide of 3.5 millimeters in neutral. This was not on flexion extension. I was an author of this paper, which is the largest biomechanical paper that's on this site too, and all should have, where we looked at instability of car crash and non-injured car crash patients with instability, right? So again, the paper that we're talking about here tonight, a lot of these patients reached the upper threshold of instability just in neutral. This was just a neutral view. So there's a lot of studies to show that car crashes cause instability. And again, on the site, I just searched instability crash and look at all the papers and research articles and everything else that pops up. If you need information and want to inform yourself and your patients and use it for documentation for your notes to say, here's another paper that car crashes cause instability. From the ALL to the facet capsules, to the alar ligaments, the transverse ligaments. So we also looked at spondies or aneuroses. And what we found in this paper was about 10% of the patients ended up getting aneuroses on just a neutral view. And as you can see here, this is kind of what we looked for. Ideal was this color, patient 22 before the crash, 22 after, and you can see how there's the kinking that's occurring. So we found segmental translational modeling in 10%, and segmental translations were identified on the post-crash radiographs that were different than the ones identified in the initial. And what we found was this change. So we did see approximately 10% just on neutral, almost exceeded the upper end of instability without a flexion extension, right? And these were patients that were already hurt. So they get another crash, and we're seeing that there's some significant translations that are occurring. So all these things so far, the mid-neck buckled more, the upper cervical spine got more anterior head translation, and in 10% of the patients, we saw aneurysthesis without even doing a flexion extension. So the discussion of this paper, there's some great things that are in here that, again, you should be aware of. You should be able to talk to your patients about it. You should have access to it to quickly put in your notes. You should talk to all of the providers and attorneys to show that, hey, this needs to be addressed. We understand that these things happen. And if an insurance company asks why, you can say this, and this should be in your notes, and part of this should be in your notes. The present study was undertaken to compare the sagittal cervical spine geometry and radiographic alignment. And we hypothesized that the following exposure or crash and a patient's cervical lordotic curve would be altered as a result of the crash. Kind of what we thought, kind of saw it in practice, but there's no studies to support that other than biomechanical studies in the same patients. The cervical model and radiographic alignment variables before and after a motor vehicle crash exposure confirm our primary hypothesis. So what we found was that these patients did have a bad curve, but the car crash with no other variables caused a worsening cervical sagittal alignment. And all those things are linked to poor outcomes and poor health. And most of those biomechanical properties can be what? They can be fixed with our care. That's the important. I hear all the time, patients don't care about research. You're being lied to. You cared, right? Look what happened when COVID came out. Show me, is this working? Who's getting it? Who's not? To say they don't care is an insult, I think, to patients. They need you to care, right? Maybe the patients might not know that they should care, but they want a doctor that cares. This is research to show. This is what's going on. I can validate this, and I can show that our care is reasonable and necessary. What about kyphosis and pain? Big deal. So the loss of curve, I see that all the time, as some insurance IME would say. That's not true. Taken as a whole, the literature detailing patients involved in a motor vehicle crash and those with whiplash-associated disorders indicate that hypolordotic, straightened curves, or S-curve, or kyphotics are risk factors, generally leading to worse outcomes. And there's tons of stuff on the site to show you that. Data from Marshall, for example, provide evidence that patients involved in a car crash injury have a 10% mean reduction in C1 to C7 Cobb angle. So we looked at all this, and again, how motor vehicle crashes are linked to worse outcomes, right? What's the percentage of patients that suffer chronically for the rest of their lives after a crash? Over 50% is one of the reasons why a potential more buckling of the curve, it's poor curves are linked to poor outcomes. We now have a paper to show that this is happening in the general public. So again, professionally integrated resources like does kyphosis and pain, right? Here's what's on the site to look at. I just went to diagnosis and loss of curve. Under each one, you have causation and chronic. I looked at chronic, tons of papers come up. You click on the thumbnail. There's a video you can listen to. Here's the paper broken down with things that you can copy and paste, show your patients. That's the whole point of this site for less than one patient visit. Your patients need this. You need this to validate our care of why patients struggling with spinal injuries, pain, and disease related to the spine should be getting chiropractic care. The research strongly supports that these abnormal configurations and instabilities and spinal issues are problems. We also published this. An S shape in the cervical column can be described as the first order buckled mode, flexion extension, flexion in any region as the second order mode, and etc. Where these are increasingly in complexity based on the number of directional slopes. Oh, well, the loss of curve is due to muscle spasms. It's just due to a muscle spasm. There's studies that were done. Dr. Curtis Fedorchuk published a study with this. We obviously discussed that. And again, we wanted to put this in so this one paper can be used to combat that. Oh, no, that's in my notes. I actually mentioned that. I'm not sure why the IME is saying that's true when I actually put some references in here that we know that's not true. And that's why we didn't send him for just muscle relaxers, because the muscle relaxers wouldn't put his neck back in the normal lordosis, right? And look what we just write here, right? The loss of the curve and the buckling occurs 2 to 3 times faster than the muscles can respond anyway. The muscles may be spasmed due to damage of the ligaments, and now the muscles are trying to protect the injured area. But the neck is not buckled because there's a loss of curve. The loss of curve occurred due to damage and a snap through buckling that damages and disrupts the ligaments. Those damage and disrupts the ligaments, including the disc, can then send a signal to cause a mild spasm reflex for protection. We have to fix the mechanics before we go ahead and just try to fix the muscles. So what we find with pain scores? Well, in our population, the following exposure to a crash, the average NRS and neck disability nearly doubled. So in every patient, when we had their neck pain disability of the crash before, and then they got in that second crash, their neck scores doubled, right? So again, we saw a change in the mechanics, the buckle, we saw anterose, and we saw anterior head translation, and we also found that their neck pain scores doubled. We also put in here emergency room doctors. And what I mean by that is we think, and we know, and we publish this, that emergency room docs should be aware of this. And this is something you should be using to discuss and to talk to emergency room docs. And for members out there, and if you're not a member, join, because we're doing a webinar soon with an emergency room doc who runs the ER and first responders, teaching you how to get your information, using professionally integrated, into the emergency room so you become a referral source right from the ER. That's we do that. And I'm going to show you how and how we did that with professionally integrated. But what we put in here, and this is again, one more paper that you should show them. Trauma physicians and ER physicians should be aware of these abnormal spine parameters, which are visualized via radiography. They send the patient for an x-ray and it comes back with a loss of curve. Educate these docs in the emergency room. And we're going to show you how, with a webinar with the person who runs the ER and the first responders here, and how I got our practice into the database so that they are aware of this information and they can refer right to us. So the conclusion that we have here, and I see that there's some questions, and I got some text too. Just ask away, and we're going to do a live Q&A after this. So an altered cervical curve was identified following exposure to motor vehicle crash in 41 retrospective cases from 3 patient centers. The 41 patients had a prior lateral curve. And again, you can read this. I'm not going to sit here as a talking head. We found an answer to the question, how do you know? Well, history is important or lack of history, head position, biomechanical studies. This is the first paper that was ever done. So when some insurance company comes at you because you're trying to fix someone's curve or you diagnose them with a loss of curve and you're trying to get it better and you're billing the insurance or you're asking your patient to pay your bill because of these things, it's more evidence to suggest and to educate them on why you're doing appropriate ethical care. I think with the evidence now, if you don't address this, I don't think that that's appropriate or ethical, to be perfectly honest. These abnormal biomechanics are linked to horrible outcomes. Who has the best solution for that? Extra strength talent? Of course not, us. But if you don't document it, you don't educate it, you can't fight for it. You can't fight for your patient. You can't fight for chiropractic care for the community. So document it, validate why, right? Why is this? Why is this important? Okay, so you diagnose the loss of cervical curve. So why do you think it's from the crash? Use this paper, use the other research articles that are on the site to pepper your notes. I have tons of webinars on how to do SOAP notes and exams and use the site to make it super simple and validate your treatment and their diagnosis. Validate your care. I'm treating them because of these things. I can't release them with this. I've mentioned that they would probably get worse. So as of right now, right here, like for all you people that aren't members on the site, take a picture. You get 50% off the initiation fee, which is already less than one patient visit. If this information isn't valuable to you, call me. I want to see why, and I want to see how we can make it more valuable. But this is a great paper and another study of why we should care about research, why we should use our knowledge and education to educate our patients and not do a script or sales. If that works for you, that's great. Look at the evidence to suggest why they have problems and what we can do to make them better. So let me just see here. So I'm going to look because there's a lot of you on here, and I'm going to see if I can answer some of these questions the best that I can. Hold on one sec here. I'm just going to, there we go. I'm going to pull this down. Okay, so let me just make sure you can see me. Yep. Did the vector of the second impact recorded play a role in the magnitude of the worsening findings? So we didn't see that. We didn't see that rear end was worse. One of the things was certainly head position, and that's been published in a lot of papers. And again, so we didn't say like, hey, the rear end caused more aneurose than the side. What we found was that the impacts, and there's so many, and again, it's a great question because the amount of variables that come up with that is something that we need to discuss. Right. So if you go, right, so let me just see. Right. So if you just go here and you put like head turned or something like that, right? And and this is how I use the site all the time, head turned, you're going to see head position and car crash injury and all sorts of stuff, tons of stuff that are also larger variables. Right. Here's one that talks about head position in traffic injury prevention and how that led to more upper cervical damage. Head being turned. You could look for head and facet or head position and upper neck. Right. All those things seem to be bigger variables than the impact. And we also showed that in our paper, this other paper here as well, our digital motion x-ray paper, where we didn't see that either. It was the head position. Females are, if you type in female, of course, have worse outcomes than just the vector of crash. And that's because of the head restraints and all sorts of stuff. Here's a female head neck model for rear impact. Gender, has been shown to be an important factor. I put stuff like this right in the notes, all for you to have right here. Boom. And this is from Journal of Biomechanics, right? So now when someone says, oh, I don't think the gender doesn't matter, you're like, I don't care what you think. This was published. We know this is a problem. And now you can explain it without a script because you know it and you're educated on it. So what we found was more, we can't say that, hey, passenger side impact caused more damage than a rear impact. They all cause damage. Okay, so I'll stop the share here and let me get back. So that in a nutshell is pretty much what we found, something that you should take back to your practice, use, educate your patients, and explain to them and show them what's going on. So we are, if I'll give it just another minute, if anyone had any further questions, be tuned. We just did another webinar with a great lawyer. He was undefeated in MMA and in Pride, big jiu-jitsu guy. He even fought again as a lawyer now against the FBI and police and insurance companies. Just we're getting ready for a date for that. That's already recorded, and we're going to do live Q&A with him on telling us, like, what does he need, right? What does he need from us? What happens in the courtroom, and how you can help your patients by using the site to document correctly. After that, we're doing another webinar, as I mentioned, with an ER doc. He's going to show you how we use professionally integrated to get into the emergency room. So my information, my practice is in the emergency room. So when these docs come in, or these patients come in, they understand some of this research, and they're like, okay, get into Dr. Katz's office, and our information is right there in the hospital. And we did that with the site. So we have a bunch of great other webinars coming up. I'll give it just another couple of minutes. I don't want to take all of your time. I know it's Tuesday evening. I'm sure you all have a lot of great other things to do, but more power to all of you who logged in. There was a lot of us on here. This is what it takes to get ahead, right? The grind, no easy buttons. You're taking the time to learn. I commend every single one of you. Now you're going to take this information back into your practice tomorrow, and you're going to be charged, and you're going to document correctly, and you're going to show why. Use the site like that every day. Listen to one video, two videos, just once a week. Educate your patients, make sure your notes reflect it, talk to whoever wants to hear on why your practice is the best, and use your knowledge based on the research that's on here to grow your practice. So I hope that you found that all informative. It doesn't look like there's any more questions. I don't want to hold you all up. And again, if you do have questions, hit me up, text me, email me, send me a message on Facebook. I'm more than happy to help. And I know what we do is the right solution for these patients. We need to be a part of every patient's spine treatment. So my cell phone number is 303-594-8969. And you can find it on Instagram, like Professionally Integrated, on Facebook, tons of different ways to find me. You can Google my name and it will come to my office number. So please reach out with any questions that you have. So I hope that you all found this very informative. And and thank you, hey, for the work. And this was a lot of hard work. They all are. But again, I just think this research is important to push us forward, to show what we're capable of, and to show why these patients are suffering, right? I mean, that's what it's really about. These patients don't know where else to go. They don't know, because most of these people are kind of like, great, Becky, I'll see you in a week. I'm looking forward to it. They don't know where to go. They've been to tons of docs. Oh, I don't know, we got an x-ray report back. Oh, and they ignore some of the findings. Well, now you can go to these docs that don't want to take the time, the primary cares. Hell, we have tons of webinars on here on how to use the site to educate these primary cares. They don't want to deal with this, right? Hey, you got an x-ray report back. So there was an abnormal cervical curve that's associated with crashes, and we can help that. So yeah, so anyway, that's pretty much it. I'll give it another second if there's any more questions, but thank you all so much. Please, if you're not a member of Professionally Integrated, join. If you are a member, thank you so much, and just use it more, and please let other people know. I'm just trying to grow the site so that we all have this amazing knowledge and information to pass along to our community and patients to make sure that your office is the one to go to. So thank you all so much. Have an amazing Tuesday night. And I'm super proud of this paper, and I'm super happy we were able to get it out there, because I think it's going to help a lot of patients get the appropriate care they need from docs like you. So thank you all so much.